Our next speaker is Ζωή Ράπτη, who is the Deputy Minister of Health in Greece. Unfortunately, Mrs. Ράπτη is unable to join us today, but we have a pre-recorded presentation by her.
Dear all, Your Excellency, WHO Regional Director for Europe, Dr. Kluge, Alternate Minister of Health, Dr. Gaga, Honorable Rector of the Aristotle University of Thessaloniki, Dr. Papaioannou, esteemed professors of the Greek diaspora, thank you very much for inviting me to participate in the Aristotle Medical Forum session, Facing the Pandemic Focus and Focus on Well-Being. I would like to congratulate the School of Medicine of the Aristotle University of Thessaloniki for their initiative and to wish every success in the endeavor. It is a great honor to work alongside with esteemed professors from the Greek diaspora, the WHO, and the mental health professionals of the country on the crucial matters that the pandemic has brought to light in the health sector and especially in mental health. As Hippocrates stated 2,500 years ago, every disease starts from the soul. To this direction, in 1948, WHO defines health as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. This puts mental health as a top priority not only for governments but also for societies as well. Mental health remains a key concern in Greece. The economic crisis of the recent years and the pandemic have led to a significant increase in psychological issues and disorders and exacerbated existing inequalities regarding the accessibility of mental health services. The pandemic has brought sweeping changes in all people's lives in a way that put us in a survival mode. It is essential, though, to start thinking how to reestablish the concept of well-being in our lives. In this frame, it is important to promote the global and wider development of people, their health and mental health, and eventually well-being for the whole population. There is a need to strengthen the evidence-based approach towards establishing quality prevention and response services to advance mental health according to the needs of each target group, and this must be done with the optimal utilization of resources. An additional feature of the pandemic is that not everyone is equally affected. The mental health burden is much higher and the poor and vulnerable groups, bringing to the surface inequalities in the population that already existed. This is also reflected in the unequal distribution of mental health services across the country. To respond to these challenges, significant steps have been taken so far by the Greek government during the COVID-19 pandemic. Psychosocial support through telecounseling for COVID-19 patients in the hospitals as well as their families and the staff of our hospitals. The hotline 10306 for psychosocial support to COVID-19 patients, their families and the general population. Development of the information system of the National Health Service, BI for Health, that ensures the collection, processing, and dissemination of data of the public health unit. Creation of a digital map in mental health services all around Greece that facilitates the citizens' access to mental health services. Development of mental health facilities for children and adolescents all over the country, and also units for early intervention in psychosis that will be developed in the near future throughout Greece. Also, integration of mental health in primary health care with the development of telepsychiatry network in collaboration with the private and public sector, with the aim to provide exactly psychiatric services and psychosocial support to adults, children and adolescents that live in remote areas of Greece. A telepsychiatrist unit has already been set up and operates on the island of Castellorizo. Development also of psychiatric services and community units for dementia patients throughout the country, and of course, unfortunately, on top of the pandemic, Greece has been going through a quite challenging period of wildfires. In order to take immediate actions, the Ministry of Health provided psychosocial support for fire victims, both on the spot as well as with psychosocial support through the hotline 10306. Although the challenges were immense due to the pandemic, the Ministry of Health continued to strategically plan the future of the mental health system in Greece. In collaboration with WHO, we conducted a joint review of the current state of mental health services in Greece that will contribute to the improvement of our mental health system. The joint review led to the creation of the National Mental Health Committee, the members of which were assigned to work on the National Mental Health Action Plan for the next decade, 2021-2030. In the direction of promoting mental well-being, WHO, under the leadership of Regional Director Dr. Kluge and the support of the Hellenic Republic in Greece, launched during the pandemic a new sub-regional office in the country focusing on quality of care and patient safety. This was done in alignment with the European Programme of Work 2025, United Action for Better Health. Moreover, our tireless efforts to overcome the severe consequences of the pandemic and create a social network of mental health services across Europe led to the Athens Mental Health Summit 2021 and the adoption of the Athens Declaration, which formed a stepping stone of the implementation of the European Framework for Action of the WHO European region and the WHO Mental Health Coalition. Thanking you once again for your invitation, I wish you every success to the global initiative of the School of Medicine of the Aristotle University of Thessaloniki, and may it continue working in the years to come. Thank you very much.